Fracture is a partial or the complete break of the bone. Fracture ranges from the small to partial crack or complete crack or the complete breakage of the bone. This class we will see about what is the causes of the fracture. Before seeing the causes of the fracture, we will see what is the anatomy of the bone. If you long bone, only 80% of the fracture happen in the long bone. If you see that the end of the bone, it is called the epiphysis area. In the epiphyseal area, there is a line is called the epiphyseal line. This is the head of the bone, this is the neck of the bone, this is the epiphyseal line. If you see the coverings of the bone, is first one covering is called the periosteum. The inner covering, second is called the endosteum. Then this is the medullary cavity. Each bone, if you see, there will be a small hole will be there where there is a arterial and blood supply will be going through that one. This is a spongy area of the bone. Okay, so this is the diaphysis, the shaft. This is called the shaft and this is called the diaphysis. The growth area is called the epiphyseal. This is all the condylar region. Their ligaments, attachments will be there in both sides of the bones. And the joints, when there is two bones are joining together, that's called the joints. So this is the small anatomy, head and neck, coverings of the bone, spongy area. Epiphysis is the growth of the bone, just like that. What is the causes of the bone? Mainly by the causes will be the any repetitive force or fall down or sometimes direct force, some car accidents or injury, pathology mainly because of any of the osteoporosis or bone cancer or any other secondary problem, anything may be causing, especially if you see the ladies are above menopausal age, there is a estrogen hormone play an important role for that. So when the estrogen hormone playing an important role, there is, and vitamin D is also a playing role. So if estrogen is there only, the absorption of the calcium will be in a proper manner. So after menopause, many pathological changes may, how to prevent it? So prevention, you have to take a calcium rich diet, or if anything needed, with the help of doctor, with advice, you can take the calcium supplement from the age of 35. What is the fracture? This we have seen that's a partial or incomplete break of the bone. According to that partial, incomplete and the size and the design of the break, the bone's fracture has been classified. Green stick fracture. What's green stick? Green stick fracture is a partially fracture. Only one side light. Only it does not break it completely. It will heal very fast. Okay, mostly in the elbow, you can when we are giving force in the hand and getting up, sometimes green stick fracture. This is a transfer fracture. The transfer fracture is a straight break across the bone. It's called the transfer, straight and across the bone is called transfer fracture. Oblique non-displaced bone. This oblique fracture is one side occur and it is to the opposite axis it is going. It's a non-displaced. If you see oblique, but it is displaced. This is a two kind of oblique fracture, complete or the complete one is called the displaced. Completely there, this non-displaced, it's in the position itself. Spiral fracture. It is the one part of the bone breaks and twists and through, so it's like a round fracture through around the bones. And this is a linear fracture. Linear fracture is nothing but in the longitudinally, if the bone is fractured. It's communicator fracture, or it's like a compound fracture or communicator fracture. Its bones are broken into many pieces. It's very, very difficult. You have to go for open reduction surgery, everything. Okay, whatever it may be. What is the first aider must see? What is the signs and symptoms? This is very important for the first aider to understand. First is the swelling, severe pain, and sometimes bleeding will be there, sometimes bleeding may not be there. Bruishiness, if the bleeding is also there. Loss of function, that means they cannot move the leg or hand or the affected area. Sometimes very shock and then wound or deformity in the particular area. So this is called the signs and symptoms of the bone. If you see the complications, what will be the complications? So first aid we will see. Before that, these fractures also will be giving some complications. The bone will be, if some people will not go to the doctor, so blindly they will attach the bone and put some bandage or some traditional treatment. So the bone will be healing in a wrong position, but healing will take place in a wrong position, deformed way. Disruption of the bone growth, and the bone marrow infection may happen, and then avascular necrosis. Sometimes, rarely, one complication is called air embolism. If near the ribs or something has been broken, or when the open end of the bone is not closed it properly, the air may be enter to the vascular area. So, first aid. What is the first aid you will be doing? You have to quickly assess the patients, assess the victim. This is a golden hour, so quickly assess the victim, look for the symptoms, pain, try not to move the area, and whatever the material which is available, make it a splint, check for any external or open, is that open or the bone is outside, it's open, just close it. Okay, check the internal or external bleeding is there, or use some splint. Splint is like any stick or scale, whatever it is available, that you keep it as a splint, and the splint will help you to immobilize. So remove any ornaments which is very tight, or sometimes clothes are very tight, just remove it and arrange the transport immediately. Haul for that. If the person is very conscious, okay, if he go for the unconsciousness and breathing is also not there, conscious but breathing is there, put him in recovery position. If unconscious, no breathing, then you start with the CPR. If he starts breathing, keep him in a recovery position. So how you can prevent the fracture? We have seen what is types of fracture, like a pathological fracture also there, this is a ground stick or this one. How you can breathe? This pathological, eat the good food. So that simply people will climb in stair within a minute. They just one step falling from one step, it causes fracture. Why? Because of the weakness of the bone. So to prevent that, eat better diet like milk, cheese, yogurt, green leafy vegetables. Go in a sunlight. Do exercise. Exercise will increase the blood supply to the bones. And estrogen play a vital role, as I told you. So the menopausal woman must be taken care of very well. So this is about the fracture of the bone, the first aid management of the bone, or short notes on fracture. You can write and draw and write it. So you can write a question about define fracture, or what is the classification of fracture, management of fracture also you can write the same, and first aid management for fracture also same thing you can write. Thank you.